Healthline's reference library defines nosocomial infections as infections that are acquired in hospitals and other healthcare facilities. To be classified as a nosocomial infection, the patient must have been admitted for reasons other than the infection. He or she must also have shown no signs of active or incubating infections. There is no definite criteria for these infections. However, these infections occur up to 48 hours after hospital admission, up to 3 days after discharge, up to 30 days after an operation, in a healthcare facility when a patient was admitted for reasons other than the infection. World Health Organization in 2012 rates urinary tract infections, surgical site infections, bloodstream infections, and pneumonia as the most common form of nosocomial infections. The CDC's Healthcare Associated Infections Prevalence Survey provides rates of nosocomial infections in the United States in 2011. The total number of nosocomial infections for this year was 721,800, with pneumonia being the highest at 157,500. As per Better Health Channel's article on nosocomial infections, there are specific populations that are most susceptible to these infections.
I think if everybody is kind of putting in their best effort to do good hand washing, sanitizing the rooms well before other patients come in, and we're all trying really hard to stay clean and to do our precautions like droplet precautions, contact precautions, using proper aseptic technique and sterile technique in the hospital, we're doing our part. However, if you're not, then certainly you're adding to the problem. But when you have patients that are chronically in the hospital that have multiple comorbidities that are here for a long period of time, sometimes it is really hard to prevent an infection despite our best efforts. So I don't foresee that it would be anything that would ever be something we could terminate, but we could probably do better.
So my opinion regarding nosocomial infections is they're a huge problem in medicine. I serve on the board of the hospital as well as on the Quality Improvement Committee for Yakima Valley Memorial Hospital. So they are they take up a huge part of our meetings, discussing treatment, prevention, and just education of the medical staff. So a definition of a nosocomial infection is a hospital-acquired infection. The way I look at them is they're caused by things that, as a physician, things that I do, and sometimes things that I don't do that I should be doing. So things that I don't do that I should be doing that can cause nosocomial infections would be hand washing, hand sanitizing. That's probably the biggest thing. Wearing a mask, putting my patients in a proper room, like a negative airflow room, to prevent transmission of airborne pathogens. Things that I do that can contribute to nosocomial infections will be antibiotics. So sometimes I use antibiotics that probably are too broad for the condition that I should be treating. Sometimes I introduce catheters to patients' bladders, and if I leave them in there too long or if I don't care for them properly, it can cause an infection. Sometimes keeping the patients in the hospital too long. They're exposed to other patients that are ill and can develop hospital-acquired infections that way. So it's a big problem, and we do a lot to try to prevent them, and unfortunately spend a lot of money and a lot of time to treat them.
Hema Aguilar, a registered nurse at Yakima Valley Memorial Hospital, shares her opinions with us. She states, "I believe nurses definitely hold a key role in prevention of nosocomial infections since we have such direct patient contact. The most important action in preventing these infections is proper hand washing or hand sanitizing before and after each patient contact, also proper cleaning and disinfecting of patient beds and rooms, cleaning our stethoscopes at least once a shift, and PRN. Also, proper cleaning and use of aseptic technique when placing an RC or IV in a patient. All these efforts are time-consuming and require uniform compliance in order to be effective. Apart from the personal suffering, there are also increased amount of medical expenses for these infections. The resources are misused. It not only creates anguish for the patient, but also a concern for hospitals and care providers.
Hospitals now are going to be faced with, we'll call it a penalty. There's going to be, if a patient comes in for a condition that was acquired while they were in hospital and they have to be readmitted, insurers and government payers such as Medicare are no longer going to be paying for those hospitalizations. So it's a big problem financially, bigger problem for the patient. You know, patient doesn't deserve to develop a hospital-acquired infection if it could be avoidable.
Since I became a provider and in the healthcare field over the last 11 years, there's been a lot more focus. I've noticed a big change in the way that we do things, and certainly in the way that we monitor patients and the types of infections they get and why they get those infections, and if those infections are nosocomial. So should we completely lose reimbursement? I don't think so. I think that it does hurt the hospital and healthcare, but should we be held responsible that we are, using sterile technique when we are placing things like catheters? Yes. So I think maybe there could be a middle ground.
Given these concerns, health professionals are making progress today. As per the CDC, there is a 46% decrease in central line-associated bloodstream infections between 2008 and 2013, a 19% decrease in surgical site infections related to the 10 selected procedures tracked in the report between 2008 and 2013, a 6% increase in catheter-associated urinary tract infections between 2009 and 2013. Although initial data from 2014 seem to indicate that these infections have started to decrease. An 8% decrease in hospital onset of MRSA bacteria between 2011 and 2013. Sure, we haven't achieved our goal, and there isn't an end to this road. But we are making progress, and we can look forward to a future with minimal reported cases of nosocomial infections. This is a very broad aspect of infectious diseases. Please visit the Center for Disease Control website or healthline.com for more information on nosocomial infections.